Hey, my name is Madeline Washington, and I plan on attending PA school. I chose to do my internship at a family practice clinic, and I chose this site because I wanted to get some hands-on clinical experience and learn more about allopathic medicine rather than alternative medicine. At my clinical site, I was able to observe an NP and a PA alternately. We saw patients that ranged from newborn to their late 90s, and with these patients, their appointments were either physicals, disease follow-ups, or sick visits. With patients' physicals, depending on their insurance, I learned what had to be included in their physical for their insurance, and the differences between a well child, a newborn, and an adult physical. For the disease follow-ups, I learned a lot of in-depth information about certain diseases such as hypertension, diabetes, renal disease, heart failure, and how their diagnoses are monitored and how their medications are monitored. I was also able to learn a lot about different tests and blood work and what all your blood work can tell you. It was very cool to learn. My responsibilities included to sanitizing rooms, surgical tools, making sure all the patient rooms were stocked. I would assist in obtaining vital signs and doing urine analysis readings. I would also assist in the paperwork for the clinic, such as referrals for procedures or different tests, a lot of imaging. And I would also do new patient paperwork, insurance, and blood work paperwork. And I was also able to aid in scheduling. The coolest thing I was able to do at my internship was to listen to heart, lung, and GI sounds. It was very cool to learn the differences between normal and abnormal sounds. I also was able to look into patients' ears, and it was cool to see when there's fluid, when it's normal, if it's infected, and stuff like that. My goal during this internship was to just learn as much as I possibly could and take as many notes, and I definitely took lots of notes. They taught me a lot. There are some obvious cons to an internship, such as being unpaid for a full-time job, but the dislike I had was not being able to do more hands-on work because I lacked the credentials. My biggest takeaway and my main dislike comes only with my personality and me being at where I was at as a family practice clinic. I felt like the days were very repetitive. The appointments became very routine to me, but this did teach me that I don't want to be a family medicine PA and that I need to look more into specialties that fit my personality better. There are many likes about my internship, though. I'm very grateful for everything that I learned, all the people that I met, and everything that I was able to do. I was very blessed to have an amazing staff that was so welcoming and kind to me, and they were very willing to teach me everything that they knew. They definitely made saying goodbye to my summer internship very hard. To prepare a future intern for someone who is looking to be a PA, someone who's going into PA school and interning at a clinic or a hospital setting, I would say just be open to your experience, be bold, ask many questions, ask to try new things, lend a helping hand, take lots and lots of notes, be communicative, but be teachable. That's the biggest thing, is to be teachable. I would also say to be a quiet observer, watch and learn how the clinics run or what the staff around you is doing, and just do the things that they do it the way that they get it done. Use your critical thinking cap, be very attentive, and be helpful. The biggest piece of advice that I could give to you, though, is with being a PA, you're assisting a physician. So I think the biggest part of the job is also to learn your physician, learn how he practices medicine, he or she, learn how they want things done and how the expectations that they hold for their staff. So as you're being an intern, just follow along with those expectations of the staff that is around your physician and hold yourself accountable to those same expectations. But if all else fails, there's nothing to do, you're worried, you're stressed out that you're not doing enough or not doing the right thing, clean. Just clean. Everyone appreciates someone who cleans and takes care of their workplace. So just do it and enjoy it. Enjoy all the moments and all the different things that you get to do, see, and learn, and you will be just fine, I promise. I really enjoyed my internship, and I'm beyond grateful for Habersham Family Medicine and all that it taught me. Thank you.